So Medicare doesn't cover everything. In this video, we will show you some elements you can consider to complete your healthcare coverage. So Medicare doesn't cover everything, and the government knows this is a problem. The last president was trying to add some elements to make Medicare more complete. That did not get passed. So if you want to have true dental coverage, Medicare does not cover dental. Now, some of the Advantage plans do offer dental year by year, but if you want permanent dental coverage, you want to buy dental insurance. And you need to make sure that your dentist doesn't just take your plan, but you want to make sure that your dentist is actually a participating provider in your plan. We can help you with that. Now, Medicare does cover critical events like heart attacks and strokes, but you probably want to have additional coverage because a lot of medical costs around cancer, heart attacks, and strokes are incidental costs. So you can buy an Aflac-style policy to give you $20,000 or $30,000 of extra coverage. Medicare says that's okay. Medicare does not provide life insurance to bury you. You need to buy your own burial insurance or own life insurance for charitable giving separately. Medicare does cover sometimes some home care assistance related to health care. Medicare does cover rehabilitation care at a rehab center, such as a skilled nursing center, where you get 20 days for free and then another 80 days where you have to pay. Now, if you have a Medicare supplement, it will help cover that cost. But remember, that's not true custodial care where you need somebody to take care of you. Medicare only pays for rehabilitation. So if you want full care towards your long-term care needs, you'll need to get long-term care insurance. What if you've chosen a Medicare Advantage plan and that plan has large copays at the hospital or for cancer? Well, you can supercharge your coverage very simply by adding a hospital indemnity plan. It's a little tiny policy, might cost $30 to $75 a month, and it'll erase your charges at the hospital. It'll erase your charges for cancer. It'll erase your charges for accidents like slipping and breaking your hip. Ask Affordable Medicare Solutions if you'd like to supercharge your Medicare Advantage plan. So does Medicare cover all drugs? No. Medicare is not designed to cover Viagra or hair loss drugs like Propecia. And also Medicare doesn't cover drugs like Valium or Xanax. Now your plan that you choose can optionally add those drugs as a convenience to you, and some do, but that's not a requirement. It might change each year. Also, Medicare does not cover experimental treatments, and also drugs for weight loss are not covered. This is important. Some plans will cover Ozempic and Mounjaro as diabetic drugs, but that's not for weight loss. That could change in the future. They are discussing it right now. There's a lot of times new drugs that come on the market. They're brand new. You might see them advertised on TV, but they haven't made it through to Medicare. They might be FDA approved drugs and you can go buy them, but Medicare might take a year before they cover those drugs, or maybe not ever. All right, now that you're retired, you're probably deciding to go on some trips. Well, if you go international, Medicare does not cover you internationally. So it's a very simple thing for you to do to buy trip-by-trip travel insurance straight from our website at amsplans.com. Very easy and it's very inexpensive. Oftentimes half the cost by going to our website instead of using your travel agent. So this is important. Medicare does not cover you. Some Medicare Advantage programs, though, do have international travel coverage that's pretty robust. So that's an important question to ask Affordable Medicare Solutions when we're doing your planning and your reviews. So let's talk a little bit more about long-term care. That means custodial care. It's not skilled nursing because Medicare covers that. But long-term care says, hey, somebody needs to be taken care of for bathing, dressing, eating, toileting. You know, they need some assistance with their daily living. The plans say we're going to cover that, but you're going to have to need that care for a while before we kick in. We're going to have an elimination period, which just means a delay, where we might be 60 or 90 days that you're responsible for, and then the plan kicks in. Now you decide, do I want a 60 or 90 day wait, and then you decide how much do I want the plan to pay out on a monthly or daily basis. $200 a day would be $6,000 a month. And then you also decide, do I want it to pay out for 1 year or for 5 years or the rest of my life? And obviously all of these elements affect the cost monthly that you're going to pay the insurance company for your long-term care. Give Affordable Medicare Solutions a call and we will connect you with experts on long-term care. So what did you learn today in this video? You learned that Medicare allows you to add coverages that you need. If you want dental coverage, heart attack, stroke coverage, you can add it, and you have to pay those premiums on your own. Your decision is not permanent. If you want to change your plans or get rid of some, it's okay. But remember, long-term care is the most overlooked and most financially threatening area under seniors' healthcare journey. Make sure you're not forgetting to cover your long-term care costs. We would love to help you with your Medicare planning. Please give us a call at AMS.